Hi, Dr. Ramsey Choucair from Dallas, Texas. I'm a board-certified plastic surgeon focusing on facelifts in my practice. One question we get in this continuing series on Facelift Facts is, well, what kind of anesthesia is required for a facelift? Well, I think first of all, again, like so many things, the devil is in the details, so let's define what a facelift is. In our practice, a facelift typically means a procedure where we're tightening the deep muscle here and here, and then gently redraping the skin over it, and typically having incisions that are used to hide the incision along the hair, along the ear, in the crease, and back here along the hairline. So it's a full lower face and neck lift, improving the face from here to here. So first you have to define what you're doing, because if a colleague of mine tells a patient, I'm going to do your facelift in 2 hours and it's going to be done under straight local anesthesia or a little oral sedation, meaning no IV, they just come there, dropped off by a loved one and picked up later. They're basically awake for the surgery, although a little groggy. Well, that's not the kind of anesthesia you can apply for the kind of facelift we're talking about. So the first thing is defining what kind of facelift a patient is having. We can certainly do a, quote, facelift on someone under local anesthesia. They could literally drive to the office and drive home and call it a facelift. But what it really is a little incision along the hairline, inside the ear that stops here. We lift the skin, pull it back, and sew it. That's technically a facelift, but it's not much of one, and it doesn't provide a long-lasting effect. So the first thing we let patients know, especially when they've been on Dr. Google or they've seen other surgeons, is make sure you're comparing apples to apples and not apples to, avocados, I like to say, because you have to make sure you're comparing the right procedure. So why do we typically do most of our facelifts under a deep IV sedation or a light general anesthetic? Because A, most patients don't want to be aware for a 5-hour surgery. And yes, I said 5 hours, and on one of my previous videos I went through the details of 5 hours. It's not because we're, quote, slow, it's because it takes time to do the detail work when you're doing the deep muscle here and here, and then gently redraping the skin and stitching and trimming the skin perfectly. It simply takes time, and all that time is not surgery time. Some of it's getting the patient ready and waking the patient up, and there's a video that we did on that if you want more detail. But the reason we do a light general anesthetic is because it's better for the patient to be completely controlled as far as making sure they're breathing comfortably by the anesthesiologist, who in our case are all physicians. We felt like using physician anesthesiologists was in the best interest of the patient. I know there's controversy saying that nurse anesthetists do just as good a job, and I'm not here to say that's not the case. But in our case, in our practice, we use physician anesthesiologists. It's nice to have 2 physicians in the room. Most patients are breathing on their own for the entire procedure. Would they have a tube that helps them breathe comfortably so their airway's okay? The answer is typically yes, but it's up to the patient and the anesthesiologist to determine the best anesthetic. We use local anesthesia to make sure that the amount of anesthetic given through the vein or that the patient is breathing is minimal. And again, these are minimal blood loss surgeries and minimal painful procedure. It's very minimally painful after a facelift and during the facelift, especially if you're using a lot of local anesthetic. And so that's the reason we use a IV sedation that makes the patient pretty much out of it. They're not remembering anything from the surgery, or a light general anesthetic, both of which are administered by board-certified anesthesiologists. So I hope that helps you understand. It allows me to do the work I need to do without being concerned that the patient is A, uncomfortable, and B, it allows me to focus on the surgery because the anesthesiologist is taking care of making sure the patient is healthy and their cardiovascular status is stable and their pulmonary or breathing status is stable. So to us, we think that's the best of all worlds. Hope that helps.